Hi, I'm Dr. Blanche Grube, and I'm here having an informal conversation with one of my colleagues and dentists at Centers for Healing, Dr. Derek Grieco. Dr. Derek Grieco, like myself, has had many hours of advanced training, and one of the subjects that he's chosen to have advanced training in is something called conscious sedation. So could you tell me a little bit about the oral conscious sedation and how it works for you?
Well, there's two aspects of the oral conscious sedation. So when we're saying oral, it's something we're taking by mouth. We also offer the ability to have the patient undergo a nasal hood with some nitrous oxide in conjunction.
You mean happy gas?
Happy gas.
Oh,
yeah.
Good stuff.
So, and we utilize that in conjunction with a medication, for example, Halcyon.
Halcyon, okay.
And it works very well.
That's the Dr. George Bush medication, isn't it?
Mm-hmm.
Okay,
yes.
Just throw a little joke in there.
So gives us the ability, without putting an IV in, and still enabling the patient to be consciously sedated, and enabling us to perform a dental procedure for 2.5 hours.
Right. Because one of the Huggins rules in the Huggins Protocol is that unless the patient is sedated, you will not work on them for more than 2 hours.
Right.
So then you're saying that with oral sedation, you can work on them a little longer than 2 hours?
Yes.
Okay,
yes.
That's good.
So in all, we may be able to do a 4 or 5 hour procedure.
Okay.
Because when we say oral conscious sedation, we only want to give them one
dose.
One dose.
Right.
So we don't want to perpetuate that and keep giving them medication to keep them.
They might want it, though.
They might want it.
Okay.
It's not a safe protocol.
Now, can anybody have this? I mean, this is good for everybody?
No. I mean,
who's it good for?
They have to pass. We do a thorough medical workup, but from kids to adults, it depending on their medical history, but most of the protocol, most patients are available.
They can have conscious sedation.
Yes.
They just have to be willing and have a mouth, right?
Yes.
Okay.
Yes.
Well, that fits most of us. I think that's pretty good.
Mm-hmm.
Excellent. And so then if a patient is having, say, 8 to 10 hours of treatment, then they're probably better off having IV sedation.
Absolutely.
Where the doctor can titrate it and keep them at a steady level for a longer period of time.
Absolutely. That would be the best way to go.
Very good.
Absolutely.
Yeah, because we've had discussions that with the Huggins Protocol, the patients have to have very specific days that are being treated. We don't want to insult the immune system.
Mm-hmm.
And they're also not supposed to be treated for more than 2 hours unless they've had conscious sedation. And as Dr. Grieco has said, that conscious sedation can be oral sedation or it can be IV sedation, either way.
Right.
That's very good. Is it a good idea for a patient to have a couple of alcoholic drinks the night before they get this work done and kind of sedate themselves?
Probably not.
Probably not, okay.
But a lot of times we will give them a Valium or something of that nature the night before.
Something that you can control better than vodka. Okay.
Yeah.
Cool.
And the other thing is, it might, with having an alcoholic drink, it may inhibit the effects.
So not a good idea.
Not a good idea.
Not a good idea to have a martini or two.
And it doesn't let you sleep properly either if you drink before the night before.
Okay. Very good. So. And so then after the work is done, how does the patient feel?
Well, there's a couple of effects. One effect is they don't remember.
Oh, so it causes amnesia.
So it causes amnesia.
Oh, very good.
And another effect is if you give them suggestions as, hey, you're doing a great job, everything's going fine.
Right.
They seem to wake up and feel, everything is fine.
Right, okay, good.
So they seem to be more rested. I've had, before I was trained, we would give, do a quadrant of dentistry and be on that 2.5 hour cusp, and they'd really feel beat up.
Right.
But with the oral sedation, it seems that they awake, they're refreshed, and they feel generally better.
Just fine.
Yes.
Well, that's great.
Yes.
All right, thank you. Thank you very much. Thank God for, we call ourselves holistic, and it's very good to be holistic, but there is a time and a place for an antibiotic, and there's a time and a place for a narcotic drug.
Yes.
When I was in the hospital and needed emergency surgery, I was screaming for morphine. And I was very happy that they had it on board. There is a time and a place for everything. So thank you very much for getting that training and making it available to our patients. That's great.
Yes. Thank you.
Well, thank you. This is Dr. Blanche Grube and Dr. Derek Grieco for Centers for Healing.